Metoprolol. Chances are you've heard of it. It's one of the most prescribed medications out there for heart conditions. But what if I told you that the standard dose, the one that works perfectly for your neighbor, could be dangerously high for you? Well, it turns out the answer is hiding in two places: your DNA and your medicine cabinet. So, let's break this all down. First, we'll cover the basics of what metoprolol actually is. Then, we'll get into the really interesting stuff, your body's unique processing speed. After that, we'll uncover a potentially dangerous drug combination you absolutely need to know about, talk about some special considerations for women, and finally, wrap it all up with how you can get a prescription that's right for you.
All right, let's start at the beginning. Metoprolol is what's called a beta blocker. Doctors prescribe it all the time for things like high blood pressure or chest pain. But right off the bat, there's a common bit of confusion we need to clear up. Okay, so you might see two different names on the bottle: tartrate and succinate. For you, what really matters is just the timing. Tartrate is immediate release. It gets to work fast, so you might take it a couple of times a day. Succinate, on the other hand, is extended release. It's a once-a-day pill that works slowly and steadily. It's the same medicine, just delivered differently. Now, this is where things get really personal, because how your body actually handles metoprolol isn't the same for everyone. It's all tied to your genes. It comes down to this tiny but incredibly powerful engine running inside your liver. Let me introduce you to the star of our show, an enzyme called CYP2D6. Just think of it as your body's own personal processing engine for metoprolol. Its job is to break the drug down so your body can clear it out. Simple enough, right? But here's the twist: not everyone's engine runs at the same speed. And that difference in speed? It's all in our DNA. Most people are what we call normal metabolizers. Their engine purrs along just as you'd expect. But some people are poor metabolizers. Their engine is really slow, which means the drug can build up in their system to dangerous levels. And on the flip side, you have ultra-rapid metabolizers. Their engines are in total overdrive, clearing the drug so fast it might not even have time to work. And I'm not talking about a tiny little difference here. A huge meta-analysis found a jaw-dropping 15-fold difference between how fast the slowest engines and the fastest engines clear this drug. That is a massive gap, and it's exactly why a standard dose just doesn't work for everybody.
So your built-in engine speed is one thing, but here's where it gets even more complicated, because other medications can come along and basically throw a wrench right into the works.
I mean, think about it for a second. Even if you have a perfectly normal engine, what happens if another drug you're taking completely blocks it, jams it all up? And this is not some rare, hypothetical situation. Several really common antidepressants are powerful inhibitors of that CYP2D6 enzyme. We're talking about drugs like paroxetine, fluoxetine, and bupropion. They can literally jam the very engine that's supposed to be clearing out your metoprolol.
The results can be incredibly serious. One medical review warns about severe bradycardia and atrioventricular block in patients taking these drugs together. So what does that mean? Bradycardia is a dangerously slow heart rate, and atrioventricular block is a major problem with your heart's electrical system. These are not minor side effects, they're serious medical emergencies.
To put a number on it, this kind of interaction can increase the amount of active metoprolol in your body by 4 to 6 times. That's like taking 6 pills when your doctor only told you to take 1. And the scary part is, this can happen even if you haven't changed your dose at all. Now, all of this becomes even more critical when we talk about women, especially during pregnancy and breastfeeding. Because in these situations, you're not just thinking about one patient anymore, you're thinking about 2. Of course, for any new or expecting mom, this is the big question, right? Is this medication safe for my baby?
So here's what we know. Health authorities say metoprolol can be taken during pregnancy, especially if it's managing a condition where the benefits clearly outweigh any potential risks. We also know that it does pass into breast milk, but usually in really small amounts that aren't expected to cause any problems.
But, and this is super important, you have to be cautious. The official FDA label says that if you're breastfeeding, you need to be really vigilant. You'll want to monitor your baby for any potential side effects. That means watching for a slow heart rate, signs of dehydration like a dry mouth or dry skin, or any digestive changes. It's all about paying close attention. Okay, we've talked about your genes, we've talked about drug interactions, we've talked about specific life stages. So what do you do with all this information? How do you take control and make sure your treatment is safe for you?
Look, if there is just one thing you take away from all this, let it be this: the one-size-fits-all approach to medicine is broken, especially for a drug like metoprolol. Your personal biology isn't just a minor detail, it's the whole story.
So what can you do? It's actually pretty simple. It boils down to 3 steps. First, know everything you're taking. Keep a list of all your meds, even vitamins and supplements. Second, talk to your healthcare team, and I mean both your doctor and your pharmacist. And finally, ask the right questions. Don't be afraid to say, hey, based on everything else I'm taking, is this dose actually the right one for me?
You know, in a way, the story of this one drug gives us a little preview of where all of medicine is heading. It really pushes us to ask a huge question. Is personalized medicine, treatment that's tailored to our unique DNA, the future? Based on everything we're learning, the answer seems to be a loud and clear yes.